Hey John, it's Dr. Buford here with Dr. Moore. We're just getting started on the right shoulder. We examined the shoulder before we started. It was very unstable. It would dislocate really to the front and to the back, and this is our first look inside the joint. You are laying on your side and your arm is up in the air, so the humeral head, which is the ball part of the ball and socket joint, is at the top of the screen there, and the glenoid, which is the socket, is at the bottom half of the screen. So as you look at the anatomy initially, this is your biceps tendon. You can see it exits out through the rotator interval there. Behind that, up above this metal cannula, is the rotator cuff, and this looks normal, which is what we expected. As we look down, though, we can see this biceps anchor is loose, and we're going to have to do something to address that, I think. As we look down the front of the shoulder, we can identify this Bankart type lesion. This is where the labrum is torn off and detached from the front of the shoulder. I'll rotate the camera and look down this way. There you can see it. And then as we look around the back, we can see that this carries around the back, and you can see this labral tearing all the way around the back of the shoulder. So we're going to start with our work in the back, but we've got a lot of work to do. The first step is going to be to transfer our camera to the front of the shoulder. Pause, please. Okay, so here we are looking at this posterior labrum. You can see the tearing here. And it's too much for me to leave. I want to place an anchor down back here and see if we can't secure that. We'll take a grasp first and see if there's anything we can do to create a bit of a healing response here. This has these sharp points on it, see there? And we can use this to roughen up the capsule and the labrum and this posterior band of the inferior glenohumeral ligament. So that's what we're doing here. Showing you here is a drill guide. Placing a special type of implant. It's about the smallest one we're able to use. It's called a Y knot. It's made out of suture. And when it works well, it works great. It's makes a real small hole in the bone. There you can see the suture. That looks really good. I need to pull back on it to seat it. And now we have a good strong hold with these two sutures. I'm very happy with that. So we'll take our crochet hook and we'll take out, hold the green hand, we'll take out one of the sutures out the front like that. And we're going to use a special instrument called a suture hook next. This is loaded with a black wire called a super shuttle. Let me show you. There it is coming out of the tip. Okay. So now we're going to start here and go into this ligament right about here. Okay. And we'll come down. Right there. So we'll feed the relay. We'll retrieve it there. And then we're going to load that outside of your shoulder. Pause. So you can see as we pull back, hold it, camera. Bring that suture underneath. Like that. Now we've got to decide how we're going to tie this. I may just pause, please. Okay, so now we're getting ready to tie the first knot. See how that secures the labrum nicely. Okay, we'll go ahead and finish this. Pitch, and then we'll cut this. Okay. Okay, now we're going to have a look at this posterior labrum, make sure that we're done here. Okay, so this posterior labrum looks stable now that we've got that one stitch down. See, I'm using the cannula just to kind of stress it, and that looks pretty good. Now we're going to work in the front. You can see what we've got to do in the front here. We've got this labrum that's detached. So we're going to go off on the video and change our cannulas around. Pause, please. Okay, we're using the same instrument we showed you earlier just to free up the edge of the labrum here. You always get a little bit of bleeding because there's some scar tissue here. But luckily, you haven't lost a lot of bone. So that's good. That up there, it looks pretty free. Now we're going to use the same type of implant we used in the back. It's called a Y knot. There you can see a little piece of cartilage there. And usually when they're that small, they're not really salvageable and not necessary for the success of the repair. So we're going to go ahead and stop there. There's our stitch in the back. Somewhere about here. Okay, here's our implant in the bone. It feels very solid. And the next step is to go ahead and reach in from the back and we'll take out one of these sutures right here. Pause, please. Okay, so here we are with our hook. Start way down here. that in just a minute. Okay, here we are pulling back on the wire. And we will take a grab. Okay, so there's the first one tied. You can see how that helps build that bumper. Now we're going to place another one. Place this one right about here. Same type of implant that we've been using. You can see it right there. It's a good picture of it. It feels very solid. So now that's our third why-not suture anchor that we've placed. Pause, please. Okay, let me see the bump of this one. Never mind. Okay, so we are done with two of the sutures in the front. Again, just to give you an overall view, there's the one in the back. There's our great cannula, and then there's the one in the front at the bottom. There's the one above it. Now we're going to place a third one. You see the drill guide coming into the picture. Just a minute. There it is. So this third one needs to go in. See, this labrum's loose here. I'm just concerned about that, especially with the biceps anchor being involved. So we're going to place the third one about here. Okay, there's our third suture tied there, and that'll get covered up with soft tissue. Okay, so hopefully you can see a big difference from where we started. Now we're going to have a look at the biceps tendon. Pause, please. What we're doing here is just taking off some of the cartilage so we can repair this biceps anchor. You can see the bone underneath. The bone's kind of that yellow, orangish looking stuff there. And the way this looks, we're going to at least place one why-not anchor here, and then we'll decide what to do in the front. Looks like it's not unstable farther back, so let's get the guide and see how we can position this. Okay, so that's in and it feels very solid. We're going to take one of the sutures out the front. Okay, and we'll take our suture hook. Start back here behind the biceps. There you can see the tip coming out. Oh, I got you, I got you. Going out here, here you go. Then we'll just load this outside your shoulder. Back. And that gives us this loop right here that we're going to tie next. Okay, we've got this final suture suture tied in the back. You can still see some gapping here, and there is some normal laxity in this part of the labrum in the shoulder. We're going to make a decision on what to do in just a second here. Pause. Okay, I'm happy with the way this looks now. You can see we placed one more stitch in front of the biceps tendon, and that now looks a lot more secure. I'm happy with that. Again, the rotator cuff above looks great. Now we've got the biceps secured. As we look around towards the back, it may be hard to see. Well, there it is. You can just see our suture in the back, holding down that posterior labrum. And then we've got 3 in the front. And now we're going to finish up and get you back to the recovery room. So I really hope this does the trick for you. Good luck to you. Now, we've got a total of 6 suture anchors in, so that's a lot to put in a small glenoid, but I think you needed it. So take care. Good luck to you now. Bye-bye.